When you're working in the hospital, you will come into contact with a whole range of professionals, from doctors, healthcare assistants, physiotherapists, occupational therapists, different types of nurses as well. So you could come into contact with a paediatric nurse, a mental health nurse, or any nurse specialist who's gone on further and specialised in a particular field. You could come into contact with them, especially if you need to refer a patient. Say if a patient has diabetes and their blood sugars are everywhere and they're unstable, you would refer them to the diabetic specialist nurse who has done post-university courses in diabetes, and that's her skill. You'll come into contact with a lot of people, porters who take the patients from one ward to another, from one ward to X-ray. Also domestics as well, who clean the ward. You'll come into contact with them, and you may have to talk to them at times and tell them where to clean if there's been a spillage or anything. And also with working within this career, it's very important about relatives as well as your patients. Obviously you'll be working for them because you'll be caring for them, but it's also the relatives and thinking about them, and you need to be able to talk to them as well. Whilst you're at university, at UWE, you have there's a module that runs throughout the 3 years called Interprofessional Working, and this is where you learn about different government policies and strategies that have been set up to improve interprofessional working, because at the end of the day it's all about improving patient care, and to do that you need to be able to work and be able to communicate effectively with everyone.